I know one of the biggest mistakes we make is when we go to a different culture and we don't understand that culture and we try to take American models of treatment and intervention and superimpose them on different cultures. It never works. Even when the audience is polite and smiles and nods their heads, it doesn't have any lasting value. So learning from our speakers, the one we just had, the one we're going to have, is very important. So thank you for helping sensitize me and the rest of the audience to this issue. So I believe our next speaker is going to be talking about something very similar.
So while we're waiting, actually this could be a good time to see if there's anything specifically you, as the audience, would like to take away from this talk, because I've noticed when I give talks, I could talk about something that I think may be relevant, but sometimes the audience may not feel that it's relevant. So what I've learned is to sometimes just ask in the beginning to see what people want to learn from this talk, and then I could actually integrate that in. The topic is what are the barriers to really Middle Eastern getting the help that they need? And the help is really around getting the appropriate assessments for individuals who may have problems with brain development, or sometimes it could just be just getting the appropriate help that they need with emotional support. But is there anything that you guys want to take away before we get started? Yes? Prevent autism. So one question is, how can we prevent it? And I think the speaker later will be a better person to answer that. And we can sort of talk about how to address the barriers to prevent it, but I think the next speaker would be a better person for that. I wish I could answer that, this one. And if you ask, and if I don't know, I'll tell you. So. Yeah. Anything else?
What are the questions that usually come up if you've done presentations in Middle Eastern communities? What are some of the issues? I guess maybe you were talking about it, but now that we have some questions.
Yeah, that's a good, and actually one thing that I do is I actually assess Iranians and Afghans in my private practice for individuals who have memory problems, dementia, or sometimes psychological challenges. And what I've learned is that the biggest barrier, you mentioned this earlier, which is that, you know, the way we assess Middle Easterns is using the same framework as, you know, in America, which is to use this test, the test that, for example, if you want to understand if someone has attention problems or memory problems, or they have repetitive behaviors, and they make certain hand movements. For that individual, you do a test, and you compare the results of that test to a group to see if their results are above that group or below that group. The problem is the group that we compare to right now is they're not Middle Easterns. So Middle Easterns perform very differently on memory tests and attention tests. And a lot of times Middle Easterns look more impaired. They look like they have much more problems than they actually have. But it's mostly a language issue. So a lot of times I get referrals from, actually I get referrals sometimes from different hospitals to evaluate someone who's Farsi speaking, because they're worried that the person has a neurodevelopmental issue, or they may have dementia. And when I evaluate them, I realize that the person, just their English may not be that good. And so they were tested in English, and they couldn't be tested in Farsi. So they actually look like they have more problems, but they don't. They're actually okay. So one of the issues one of the barriers is us actually beginning to develop tests that are specifically for Middle Easterns. And what I do right now is I contact researchers and neuropsychologists from Iran. Shiraz University is one of them, actually. And I say, hey, I saw you publish this test for dementia. Can you send that to me? Because the test that I use in America is not appropriate for Middle Easterns. It doesn't give me the same results as I need. So it's a lot of work to do that, because sometimes people don't get back to you. But I think that's one of the biggest barriers. We don't have the right assessment tools for Middle Easterns who are living in America. And I've written about this actually, which is that individuals like Iranian Americans, if let's say you had someone who you were worried that they have some sort of neurodevelopmental issue or dementia, the test that's being used that's going to determine whether this person has a disorder is flawed to some degree. So it's a big issue that we're facing right now, and we need to come together really to build up enough really funding to make appropriate instruments, which actually I'm working on right now, my own research. I work at UC Davis, and I teach there, and I see patients there too, in addition to my own private practice. And I'm also doing this for our friend, Dr. Marcia Chinchion, who could not be here. But we wanted to really talk about the barriers. Sometimes the barriers aren't just around the tests that we use or the type of assessment that we use. Sometimes it just could be the reality that Middle Easterns are minorities, and minorities don't get the same level of care. So we know this in the research, in that minorities they're not able to get the type of treatment and assessment that they need sometimes, whether if that's a behavioral issue, a psychiatric issue, or a neurodevelopmental issue. And they don't have what's called medical literacy, which is sometimes Middle Easterns don't even know how to talk about the problem that they're experiencing, whether if it's their child who may be having a problem or even themselves. So they don't really know how to even communicate the problem, and that's a big barrier, because then they cannot, they're unseen in the medical world. And often they can minimize, from Middle Easterns, they minimize their own problems. So if someone says, gosh, I really have a back problem, or I really have a memory problem, that means that's probably, it's been too late, you know. They probably had it for many, many years. And so one thing that we want to try to do is actually help individuals to talk about the issues that they're facing in an open way. And we have to address some of the beliefs that holds Middle Easterns from really talking about it. Sometimes they're afraid of talking about it because they may appear weak, or because they're worried that their family members may worry. And that's a big challenge, because then they're not getting the right care that they need. And the family is not able to help them, so they feel even more alone. So being able to really tackle some of the cultural beliefs around them sharing what's really happening with them without feeling like they're being judged. By the way, as I go through this, feel free to raise your hand if you have any questions. I want to make this more relevant for you. So if you have any questions, and feel free to ask. And we know that minorities also, they don't get the right treatment. And we think, again, that's due to a communication. It's hard for them to communicate what the real issue is. And the individual who is the provider they're not really aware of the cultural issues, so they're not aware of like tarof, this idea of like being polite and overly polite sometimes, to a point where the person doesn't say what they really want to say. So these cultural challenges really leads to really concrete lack of treatment. So it's a really a major issue in our society. Because and I see it, I see it, and sometimes the patients that I see, they are going from one system to another system until they finally get to someone who speaks their language and is able to assess them appropriately. So it's a challenge, and they can't get the timely treatment that they need, and so often the right treatment is delayed. So, these are some of the cultural barriers, but I think something that lays at the heart of Middle Eastern is really how the way individuals are coming to the United States, and that immigration pattern itself can be very difficult, and that could affect not only the child but also the family, and also okay. Also, along with that comes trauma. And trauma, the way we think of it is that trauma could be any type of experience where the person is experiencing intense level of fear. It's to a point where the person is sometimes even scared for their life. Trauma doesn't have to include things like physical abuse. It could be things like emotional abuse, neglect, not getting your needs met, especially at a young age. Often, of course, children are dealing with a lot of their needs not being met, maybe because of the environment itself. Trauma can include things like simply a medical procedure that was scary for a child or for the adult. And of course, trauma could include things that I think Middle Easterns have a history of, which is war, or even being exposed to war. And also, trauma could be transgenerational. That means that it could be the feelings and emotions of trauma can be transmitted from the parent to the child. So and I'll talk about what are trauma symptoms, because I think if there's one thing that I think is helpful to address barriers, is really knowing the trauma symptoms. And let me know, by the way, when I'm. I know I have a brief amount of time, so I'm. Okay. 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 Great. I thought for a second you said 5. But no. But you're just saying hey. Excuse me. And so the emotional development can also be stunted. So sometimes both the child and an adult, if they're exposed to trauma, that could hold the individual, their development, emotional and psychological development, at that age where the trauma occurred. And so this is some of the newer ideas, and that does impact brain development. Trauma can lead to difficulties with trust, not just trust of the immediate individuals around them, but just trust in healthcare providers, the trust of actually knowing that the person can actually get well and can take care of, for example, a child who's dealing with neurodevelopmental issues. So trust can be an issue, and a major issue that is rooted a lot of times in actually the reality that trust has been broken in the past. And often that past is affecting the individual in the present moment in forms of mistrust. So how do we actually deal with this? And what do we actually do? Well, thank goodness, the Middle Eastern culture has a rich heritage and a rich amount of rituals that they have where they integrate people. And one thing that we know is that to be able to support individuals who are going through a lot of trauma is to help them reintegrate with people and their society in a healthy way, where they're involved in their community, and it's a form of giving that they're sort of participating in. Just like you guys are here in this community, being involved. That itself is a form of support, and that really helps a lot. And there are also specific cultural rituals that help individuals to talk about trauma in an appropriate way through spirituality, or sometimes just a dear friend within the family system. So always kind of going back to that deep and intense, sort of rich cultural heritage that's already there is important. Oops, okay. And really trying to build trust again is another major part. And sometimes building trust takes a lot of active listening and active care for what the person's history is. And the person's history, both the adult and the child, can include sometimes trauma symptoms. And these are the things that I want us to be able to recognize. I'm going to there we go, okay. So what are trauma symptoms? What do you guys think? Like, does anybody know anyone who has had significant trauma in their life? Just a raise of hands. Yeah, okay. Yeah. It's actually a lot of individuals. Actually, trauma is part of life. So it's actually quite normal to have experienced some sort of trauma, whether it's a child or an adult. But what we often don't know is what the symptoms of trauma is. And one of the challenges with this is that symptoms of trauma, they present in your thoughts and in emotions. And it's hard to tell, because if, let's say, for example, if you had let's say your elbow was hurt or was bruised, you could see that bruising. You could see the symptom of the bruising right there in your elbow. You could feel it, you could touch it. But the challenge is, with trauma symptoms, you don't really know, because it's actually in your thoughts and in your emotions. So it's hard to know, when is this thought the thing that I'm telling myself inside my head, and when is the emotion? When is that really a trauma symptom that's not me? And when is it really me that's feeling an emotion and a thought? That's the hardest thing to do, I think, when we're working with individuals who have had challenges with trauma, which is pretty much majority of individuals. But there are certain symptoms, and these symptoms include hypervigilance. This is a fancy way of saying things like the individual may quickly react. They may feel happy one minute, and then a car may cut them off, and quickly they may go into anger. Some individuals may have a panic attack. Some individuals may have rage. Or some people just quickly have a lot of intense emotions coming up and down. That's hypervigilance. The person is on guard. That the body is telling the person that that you need to be watching out for your environment, because something bad did happen in your environment in the past. Another symptom is re-experiencing. The person is constantly re-experiencing the event. Sometimes the person can have a memory of the event, like, for example, a memory of war, or a memory of a physical or sexual abuse. Or sometimes they can have a quick flash of an image, and it goes away. Or sometimes they have dreams that's very, very vivid. That is, it's almost like it's in real life kind of dream. And sometimes, in the extreme cases, some individuals wake out of their sleep, or they're kicking and punching. And that's a re-experiencing symptom. This is really the second symptom. And the last one, although there's other ones too, but these are the main ones, is avoidance. The person is constantly avoiding things that remind them of the trauma. So they may be watching TV and something on the TV show reminds them of something really bad that has happened, and they turn off the TV. It's hard for them to watch it. It's avoidance. Sometimes they see a friend that was in the same situation as they were in the traumatic event, and they don't want to talk to that friend. Sometimes the family member may want to talk to them about what happened in the past. They avoid just talking about it. That simply could be avoidance. And the more the person avoids, the more the anxiety actually remains, the more anxiety is there. And what I'm going to do is actually, I'm going to try to go through this real quick so that we can have questions and answers. But if you can remember hurrah. It's a short way of remembering hypervigilance, re-experiencing, and avoidance. I'm going to go through the rest of the slides so we can have more questions. We want to be able to normalize these symptoms because everyone experiences it to some degree if they have experienced some sort of trauma. There was a great paper that was out. It was called, the title was PTSD, a normal reaction to an abnormal situation, which is nice because it kind of does normalize the reality that a lot of individuals can experience this. But we want to normalize it because this is something that some people feel ashamed of. Some people feel ashamed that they're having flashes come up, having nightmares, when in reality it's a symptom. It's just kind of like that elbow that's bruised. It's just something that we need to help heal. And we have actually really good treatment. If there's one thing in the field of psychology and really in neuroscience too, is that we have really good treatment for individuals who are suffering from trauma. And we want to be able to include the family. That's one thing with Middle Eastern treatment that may differ from other treatments, is that we want to be able to bring in the faith and the family system when we're working with individuals who are experiencing these barriers. So we want to integrate the family system within the treatment. If the family is not involved, the individual is typically not motivated to continue. That's what I've just noticed in my practice. And the family can really help support it, and so that the person is not feeling a lot of shame around experiencing this. Some people think that they're crazy because they're experiencing this trauma, but they're not. They're just a normal person that has gone through a very hard situation. I'm going to skip through some of these so that we can... Okay, that was actually... Okay, so if there's any questions around barriers and trauma for Middle Easterns, feel free to ask. Yeah.
So, in American culture, typical American culture, revealing sexual abuse is an issue.
Yeah.
I'm guessing that it's also this issue in many Middle Eastern cultures.
Yes, it is, yeah. And it's mainly around shame and confusion, I think, too, sometimes with sexuality. Yeah. Mix up, like, why things happened. And, of course, independent of your culture, the really sticking point is the person can feel like it was their fault. So working around the shame, this is why the normalization is very important, because they don't really know that a lot of people do experience trauma as well. But the real element that keeps these symptoms going is not that they have been exposed to an issue, to like sexual trauma. It's not that so much. It's the shame and the self-blame and the ignoring and pushing it to the side and avoiding it that keeps it going. And they don't often... some individuals feel like it would be just overwhelming to share that and go through that, and kind of like opening up the box. And it can be overwhelming just briefly, though. But then if you're working with someone who specializes in this, which a lot of people do nowadays, they know how to help the person do that. And what I've seen is when one person in the family makes a change and has processed this, has healed, it has a domino effect in the family. And people notice it because a person feels alive They feel great. They feel like this burden has been unloaded. That's a good question, yeah.
So you mentioned there's a lot of help for trauma people.
I'm sorry, say that one more time?
You mentioned there's a lot of help for trauma,
Yeah.
people with trauma, suffering trauma. Is there things they can do themselves apart from with management without going?
Yes, yeah, there is. There are some online programs where they walk you through. It's called there's online what's called cognitive behavioral therapy programs where the person just walks themselves through. But I would suggest working with a professional because trauma is, because our mind is very sophisticated. It just knows, it's very smart. And once we are trying to deal with something, it can cover it up real quick and it'll come back out. One of the issues with trauma is that symptoms come up, the person deals with it to the best that they can go down, and then something in the environment or in a relationship, people can trigger it, it'll pop back up. And sometimes we don't even know when we're in it. So I recommend working with a professional. That's the best way. And I think that's the biggest barrier is that, as Middle Easterns, we often think, okay, we got to do everything ourselves because we did do a lot of things ourselves to immigrate. Really, it's a lot of resiliency. But for this, I just suggest, it's my own suggestion. Just kick back, go, and it's worth actually addressing it with someone who has studied probably more than 10 years on it to help people. Yeah, good question. We had another. I think we had another question.
How important is it for the Middle Eastern community to reach out or to seek help from a professional who understands the culture? If somebody, for example, a professional doesn't speak Farsi and they go and talk to that person, can they still uncover and diagnose and provide prognosis for their issues, or is it absolutely essential to go talk to someone who understands the culture?
Very good question. Very good. So I'm going to repeat the question. Is how essential is it to go to someone who understands the Middle Eastern culture? Let me know if I understood this correctly too. Who can help really uncover and versus someone who may not have that background. Right? Did I hear that right?
Yeah, because exactly. Because I think kind of going back to your earlier points, issues with trust and issues with the community. I think issues with shame.
Yeah.
A lot of those, because it's a close-knit community, prevents them to actually go and talk, even to a professional who understands some of those issues. So sometimes they rather go and talk to someone from outside the community rather than talking to someone within the community. Can you talk a little bit about that? Yeah.
So I think I have a few answers for that. One is take it at your own comfort level. So if you feel like, okay, I prefer not to talk to someone who may be in the community, I prefer to go to someone who is not connected to our community, that's great. Like do what's right for you, do what's comfortable for you. Because I think that professionals who deal with trauma, they can do very similar kind of work. So I think it's not necessarily essential for the person who we work with on trauma to have the cultural background, but what we can do, because nobody can have competencies to all cultures, what we can do is we can educate the provider about our cultural background, and talking about really a lot of things in our culture that's constantly sort of going on, which is like this reciprocal relationship, these ideas of community.
We? Is that what you say, we? Who you refer to like we?
These people behind me? No, I'm just kidding. We as in any Middle Eastern that may be sort of going to, so the patient or the client, thank you for clarifying, the client who is going to the provider. So for the client to educate the provider about it.
About some of the issues that they have reservations.
Yes, yeah. So if it's someone who, I mean, if it's someone that doesn't have the Middle Eastern background, understanding of the culture, it's I think helpful for us to educate them about our culture so that we could break those barriers. And if it's someone who does have the Middle Eastern background, of course, we could still educate them about our unique family dynamics because that's still part of our culture. But I don't necessarily think it's essential for someone to know the Middle Eastern background to then be able to help a Middle Eastern. Because I think a lot of professionals will want to know that anyways, and they're often trained in how to assess and treat the trauma conditions. Yeah. Good question. I don't know if I answered your question. Did I answer your question?
No, I think you did. I was just wondering if that's because we talked about the importance of knowing the culture and knowing the community, then we can provide better diagnoses and offer better care and treatment for some of these issues. But I can see how one would also have reservations from the community to go talk to somebody, a professional who's actually familiar, because those trust issues and issues with shame, it's already there. Well, what if my therapist, goes talk to someone?
Yeah.
Those thoughts, linger in the background.
Totally. It is a very good point. Yeah, it's a very valid thought too. I mean, all therapists and providers, they keep things confidential. And so we don't have to worry about that, but that is something important to share, I think, too, with the provider. And I think where we are at right now, there's already a limited amount of providers who can work with. We have a shortage of therapists in general. So if it came down to like no help versus a therapist that doesn't have the Middle Eastern background, I would say still go get the support and share those concerns too. And know that everything's going to be confidential. It's a nice place to just kind of keep things there, and you don't have to worry about other people knowing. And
Can you talk a little about that? I think some people might be interested about the levels of confidentiality and the really strict protocol that a therapist goes through to ensure
yes,
those things stay within the confine of that group.
very good. Yeah, very good point. Very good point. So, so therapists, they're mandated by law not to say anything about what you share with them. There's some exceptions, like if someone was going to get hurt, or a child was being hurt, or an older adult was being hurt, or you may hurt yourself, then they have to try to protect people. So they may talk to like someone to try to prevent that. But other than that, everything is confidential. They can't talk about what you share with them at all. It's a wonderful space to have. It's a gift that people can give to themselves, to go there and talk about this and feel safe that it's not going to be shared with other people in the community. Yeah, very good point. Yeah, it's very common. Yeah.
Dr. Ramezani, I wanted to specifically mention that since our program tonight, it's about families who are dealing with autism.
Yeah.
So apparently there would be another treatment and a special treatment for kids dealing with autism or neurodevelopmental disorders. But the one that, beside the treatment, needs the most psychotherapy or help are the families,
Yeah.
the siblings,
Oh,
which
yeah.
are suffering a lot.
Oh yeah.
And for that, is there any kind of facility in terms of how the insurances will cover that parents will get benefit from educate themselves, even though all parents around the world needs to get education for how to treat a good child, but at the same time, these parents are under extremely difficult situation, pressure, lack of money, lack of cultural understanding.
Yeah.
And so the reason that I think these kind of programs can really be helpful is that there are a number of minorities in this country that either they came by their own will or they just the war and the destiny made them to travel. They need to get adjusted. This is not just for them, but for the rest of the community to be able to accept, understand, and share. Otherwise, the whole problem will be transferred to people who even try to be eliminating to understand their cultures. So for that, if you give us some information around, because as a doctor, you know that, is there any kind of insurance support? Is there anything that parents can get educated for themselves and their siblings to come up with the pressure that the neurodevelopmental disorder child can bring to the family?
Yes. So there are programs within the school district itself for individuals who are struggling or having neurodevelopmental conditions. Then there are parent training that's for individuals who have autism, and then of course there is family therapy. Those are a few options. With regards to insurance, while some schools, I think this varies, and I'm not up to date on this, but I think while some schools will cover some benefits, it's really the behavioral health insurance that will cover the family therapy benefits. And one of the challenges is actually we have a big mental health care issue right now in California, where it's just there's so many limitations right now. What I would suggest is to because the family needs to be involved, is for the person or the one person in the household, if they're open to it, to be able to make an appointment with the family therapist and actually bring in the family in that environment. The hardest thing is that, again, there's only a limited amount of Middle Eastern who understand the culture, and also there's not that many folks that may understand the Middle Eastern culture. So again, it does take the family to educate the provider about their background and the cultural elements in their family. And it's an environment for the siblings to be there too. It does take a multimodal approach to manage neurodevelopmental conditions, because you're not only, for example, having to help the child to go through things like speech therapy, behavioral analysis, sometimes even just working on academic and school challenges. So that's the individualized treatment. But you're also helping, like you said, the family. And so the family needs a lot of that support. The Mind Institute has different programs, but it really is hard right now because there isn't enough resources. There just is not enough resources.
I can actually help also add to your answer, which is a great answer,
Yeah.
which is, when I first started out in the field, you had a world where therapists were like, it was like a priesthood. They would take the child, go do their magic thing, and then return them to the parent, right?
Yeah.
So if you have a child or a relative who has a neurodevelopmental disorder like autism, you need to fully expect that the therapists are going to engage you, the parents, in the child's treatment. All of the modern programs, all of the evidence-based programs are training the parents as well as the child. The old days of, we're the specialist, we'll go do our little magic thing, trust us, we'll take care of this. Those days should be gone. Now, in many parts of the United States and many parts of the world, the old model persists. But we've been talking about evidence-based intervention, and evidence-based intervention tells us the more competent the parents are in their child's treatment, the better the child will do. And Dr. Hagerman, I'm sure, will also talk about that, and perhaps our next speaker will.
Yeah, very good point. Yeah, it is the parent, which means that the parent has to do some self-development too, and boundary setting. Yes. Thank you. Yeah.
Yeah.
All right. Thank you very much. Thank you.
Thank you.